This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. Very pleased to be joined by Professor Christoph Zielinski, Director of the Clinical Division of Oncology and Chairman of the Department of Medicine at the Medical University of Vienna. Professor Zielinski is also President of the Central European Cooperative Oncology Group, and I'm so pleased to see you here.
Thank you.
You are going to give us an update about what's happening here at ESMO with breast cancer data, research, maybe some of the compelling highlights.
So let's start with the first one, which are new compounds. And this, of course, the most exciting story was the presentation by Sunil Verma on TDM1 versus capecitabine plus trastuzumab in patients with the metastatic breast cancer. And it turned out that the drug TDM1, which is a combination of trastuzumab plus maytansine, which is the cytotoxic drug, which is delivered directly to the tumor cell, which overexpresses HER2, led to a significant and quite impressively significant amelioration in endpoints for all endpoints measured, including progression-free survival, overall survival, etc. So thus creating probably a completely new treatment standard for patients with HER2-positive metastatic disease. This is probably one of the major breakthroughs in the treatment of HER2-positive disease since the discovery and introduction of trastuzumab into the clinic. The second thing why I would say it corroborates what we're doing right now were two trials. One, the FAR trial, which tested 6 months of trastuzumab versus 12 months of trastuzumab in the adjuvant setting of HER2-positive breast cancer. And this was a non-inferiority trial, which did not reach its non-inferiority criteria, showing that 6 months is not non-inferior to 12 months. In other words, it failed to show non-inferiority of 6 months versus 12 months, so 12 months remaining the standard. Now the other trial, which is the HERA 2 years administration trial of trastuzumab, showed on the other hand that 2 years of trastuzumab equals 1 year of trastuzumab, and again corroborating the fact that neither a shorter duration of 6 months nor a longer duration of 2 years would be better than the administration of 1 year of trastuzumab in the adjuvant setting of HER2-positive breast cancer. So we are here in a situation where we are happy to have learned that 1 year is the right thing what we're doing. Now, new aspects are which would be the third topic, was a presentation I had the honor to give on behalf of the Central European Cooperative Oncology Group, and that was a bevacizumab trial where we compared two arms of paclitaxel plus bevacizumab versus capecitabine plus bevacizumab, as both drugs are approved in combination with bevacizumab in the European Union. And the question was, how did this impact overall survival and how are these two regimens comparable? And it turns out that progression-free survival and response rates were significantly better in the paclitaxel bevacizumab arm, in fact corroborating very much and repeating sort of the data which were presented by Kate Miller in the E2100 study, in fact showing almost equal results to the study. And whereas overall survival was not different in this interim analysis, although the non-inferiority again was not met, as this is an intermediate analysis, which was pre-planned though. So this interim analysis showed descriptively similar survival rates in 12 months, 18 months, and 2 years, but it failed to have the hazard ratio which was pre-planned at this current stage, and we have to wait for the final data for 2014.
Thank you for this comprehensive ESMO breast cancer update.
Thank you.